presentation is a combination of our progress with IBC as well as the Gene Drives the Gene Drives project that we're working on at the institution. A little background information about Ifakara Health Institute is one of the leading research institutions in Africa. It's very well known for its malaria research, although we do a whole lot of other research and implementation activities. It is organized in 3 research departments, which I'll talk about. But the mission is to improve health and well-being of our people through research, innovation, capacity building, as well as implementation programs. And these are our departments. And a lot of malaria research that we do is based on the first department, the environmental health and ecological sciences. And we also have some vaccine trials in the intervention and clinical trials. But in terms of our Institutional Biosafety Committee, like the others have presented, it's an independent body within the institution that is responsible for overseeing all biotechnology researches that are done at the institution, as well as by our partners within the country and outside the country, but for research that is done within. It is fairly new. It was formed last year. It has 7 members, 4 of which are from within IHI and 3 are external. And so it is still very new. I want to stress on that. So a lot of, it hasn't kicked off yet. And we do have plans, but we have requested for training from our NEPAD as well as our National Biosafety Committee to really make it functional. I'm not sure if you can see that. That is their structure. The institutional CED is the chairperson. And then at the institution, we also have the secretary and biosafety officer. At the moment, that is the same person holds the 2 roles. And then we have 2 additional members from the institution. And then the rest, one comes from a regulatory agency, one is an independent individual, and then one comes from an academic institution. The role of our IBC is, of course, to review and approve all biocontrol related protocols, to ensure compliance to national and international guidelines for containment and clinical and confinement trials, and to assist in developing risk assessment and mitigation plans, and also to specify practices for constructing and handling recombinant genetic material. So this is in terms of, so both for genetic and biocontrol. Sorry, I meant to add that here. So far, we've had 2 meetings since it started last year. One was the regular, so this was the inauguration meeting, and then we also had an ad hoc meeting. This was based on the progress that the project that we're working on, the Gene Drives project, had made a milestone that needed to be communicated to the public. And the IBC therefore met to advise on how to handle that, the communication. One application has been submitted for review, and this is from Transmission Zero, which is the project that is working on gene drives. And so far we have also requested, we are in touch with our NEPAD as well as our National Biosafety Committee to provide the members with more hands-on training on how to deal with such technologies. So reviewing the dossier submitted, and also how to monitor safety. In terms of the Transmission Zero project, my colleague will talk about this. But I think I just wanted to say that this is, I'll start there. To our knowledge, it is the first transgenic mosquitoes that have been not developed, but that have been actually modified by African researchers. In most other projects, normally the modified eggs are imported from outside, but in this one, it was African researchers or our own researchers that actually infected, or not infected, modified the mosquitoes. So this is actually what led to the ad hoc meeting for IBC that we had earlier. It's a milestone across Africa. How do we communicate it? So yeah, but Fatuma will talk more about, she's actually the one who did part of the team that did all the work.